afternoon, everyone. My name is Erica Sandoval, and I'm your host with Home Care to Go. We have an excellent guest today with Caring Healthcare Group. I am the CEO of Lonestar Visiting Physicians. We are located in the San Antonio Medical Center area, servicing clients as a visiting physician practice from Austin, Texas, all the way throughout the Eagle Pass, Texas area. If you would like information on our services, please contact us at 210-390-6911. First and foremost, I would like to thank Home Care to Go for establishing this platform for the San Antonio and Austin area to bring awareness to our community regarding local healthcare businesses, resource educations by our local experts. You can watch us live on Facebook, YouTube, Periscope, and on Home Care to Go's website, following us on social media, and get updates on our live discussions. If you are interested in being a host, highlight your company, or be a sponsor, please click on the link below. Today's topic is how Texas SNF providers are reacting and preparing for new rules to allow brief visits to loved ones. I would like to introduce Mr. Sam Hines, Regional Director of Business Development for Caring Healthcare Group. Mr. Hines, if you could please briefly introduce yourself to our viewers and let them know what your role is with Caring Healthcare Group.
Hey, good morning, Eric, and thank you for Home Care to Go as well for allowing me on today. So my name is Sam Hines. I'm the Regional Director of Business Development for Caring Healthcare. We operate 15 skilled nursing and rehab facilities in the Texas area. I am the Large Market Business Development Director. I have San Antonio, Austin, Dallas, Houston. We are a small family-owned and operated rehabilitation and long-term care facility.
On your company before meeting with you today, and I read on your website that your company's philosophy is based on person-centered care, which focuses, per your website, on the healthcare needs, personal preferences of the residents. Can you elaborate a little bit on what person-centered care is?
Absolutely. So we are there to take the best possible care of your loved one in the least restrictive environment possible. And a lot of times we feel that, there was so much emphasis even before PDPM started that it was just, we had to worry about rehab, and we were missing the overall well-being of the resident. So person-centered is, we pretty much, just like the PDPM model, we're looking at overall care. And we're making sure that we're checking off every box that a person needs and not just worrying about physical functioning alone. So it comes in with mental health, it comes in with med management, and it comes in with social settings as well, like making sure that the discharge is well at home. But at the end of the day, we just want to make sure that we're taking the best possible care of them without really having a lot of those extra hiccups.
Definitely. Sounds like you have a very well-versed practice going on there. The levels of care you offer are mentioned as subacute and long-term. Can you explain to our viewers that may be unaware of what those service levels mean, what each service level provides?
Absolutely. So we are subacute. So what subacute is, so every building kind of determines that a little bit differently. So a lot of facilities that I have, we do take higher acute, more LTAC appropriate patients. I've got a lot of plastic surgeons in a lot of our facilities. We've got cardiologists. I've got physical medicine and rehab. A lot of these practitioners and providers are people that you would typically find in a higher level of care than what a skilled nursing facility would be. So we do have the standard rehab worrying about physical therapy, occupational and speech therapy, but we do have that secondary added component, which is, overall higher acute care, and that kind of opens us up to be able to look at more disease processes and things like that to kind of help just serve a wider population of people. And then, of course, like every other facility, we are dual certified for Medicare, Medicaid. So we do have a very large component of long-term, quote, nursing home long-term care residents that are there for, daily needs of care, assistance with ADLs, med management, things like that, all the way down to the people that are pretty much bed bound and need 24-hour care around the clock because they're just not able to do absolutely anything for themselves.
So can you tell me a little bit about what your intake process is for a new referral? And can you tell us about the review process, who's reviewing the referrals, whether it's a director of nurses, admissions coordinator, Also, what the time expectations are for a new referral to be approved.
Great question. So we pretty much let everything operate as their own entity, as I've said before. My admissions people, I like to let them work on their strengths and or weaknesses for each building. So a lot of times you'll see my admissions people, they do both internal and external marketing. So you'll actually see them in the hospital looking at residents, introducing themselves, talking with families. And at least it's setting a single picture of a person as opposed to being one single person and then you don't ever see them again. Typically, we like to work to the strengths of the marketers. So if they're not clinically savvy or they're not, good with finances and things like that, we have somebody else do that. Typically, we like to get an answer back to somebody in 15 minutes. Even if it's a hard no, we like to get that answer back to the facility, to the case manager, the social worker, anybody like that. So at least that way they know that we're not able to take that person and they can move on to the next one and not, we're not dragging our feet all day and then at 4 o'clock we're telling we can't take a patient and then now you're stuck scrambling trying to find somewhere else to go. So we pretty much make sure that everything, that we have all the equipment necessary to take care of them. We have all the medications and things like that to make sure that we have the ability to procure all of that there at the building. Most of my admissions people, we pretty much stem from people that have been in the business for 12 to 15 years. I've got a nursing home administrator as one, and then I've got an old regional director of business development as another one. So we typically like to hire somebody that's been in the business for a while and is pretty strong and able to work and market as their own.
To my next question, that sounds like you have a very well-rounded individuals that are reviewing the cases and working with the case managers, trying to expedite and get these patients admitted as soon as possible. So that kind of goes with my next question, as I mentioned. Why do you feel discharge planners across Texas trust your company and feel confident about referring to you?
Well, we are very much black and white with a lot of these referrals. Again, like I said, if we can't take the person, we can immediately tell them that no, we can't take them, so they know how to go on to the next, they go on to the next market. But we also like to be very much a resource for a lot of these case managers. It's never a fun thing to call somebody and just hear no, 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 no every time. So we do like to expand our horizons and I always ask the question of, well, why can't we? But on top of that, over the years, like in Austin, we all have had difficult placement discharges and we've had those things. And, typically we like to be able to help and be a secondary asset is if we can't take it, I'm happy to help the case managers think outside the box and happy to help recommend other facilities that may have the capability and capacity for it. And, we stay super adaptive. So, as PDPM came in, we were practicing those months ahead of time. As this pandemic was starting, with the waiver rules and things like that, we were making sure that we were staying diligent and working as fast as we could and as best as we can to kind of help alleviate some of those concerns. And we typically find that being a secondary resource on top of just being a referral, somebody to look at these referrals, but to be a secondary resource to help them when they're not having the best of luck has benefited us greatly.
Case managers appreciate that, especially with the time restraints and the high demands that they've been experiencing, especially more recently with the pandemic going on.
Right.
So, is there any specialty services your facility offers? What advantages do you feel that you have over other nursing facilities?
Well, so every building has its own specialty. We look for market niches. We look for things like that. I've got a plastic surgeon that rounds at most of my buildings in the Austin area. So, our capabilities and capacities there for specialty beds are a lot higher. I'm actually the only Qualitron bed provider that we've had in the Austin market for quite some time, which is a big thing. It seems to be a really hard discharge disposition. And we're starting a new cardiac program out in the San Antonio market here in probably the next 3 to 4 months. And what we find is it's just continuity. I have a lot of my marketers and stuff. I don't really have a whole lot of turnover for them. I think my newest marketer has been with me for about 15 months. So it seems like a lot of times when I'm calling home health and hospices and other SNFs, I have a card for somebody, but then it seems like they're not there anymore. And we just pride ourselves on being able to help retain and keep our staff here with us. So that definitely helps in the market for us. And it kind of gives us an edge up above, our competitors from that side. But with us being able to identify market niches and be able to work to the needs of the area, and to expedite things. So I'm actually one of only 6 corporate employees that live and work here in the state of Texas. And we find that whenever we're wanting to start new programs, or we have a hospital that comes to us that wants us to pilot something, all answers are pretty much streamlined. It's only myself, and I'm calling my chief operating officer just to kind of help move to the next step.
Can you tell us a little bit, because I know there is a high demand for cardiology protocols in San Antonio area. What does that consist of?
So we're actually looking at remote telemonitoring. It's kind of the same partnership that some of the other inpatient rehab and LTACs in the area are using. We do already have a phenomenal cardiologist that's doing rounds, and then of course it's building up our EKG kits to include IV Lasix, IG metoprolol, and then IV propofol and IV hydralazine if that's medically necessary, and then just making sure that our parameters and things like that are, kind of in line with what some of the other acute care areas would be utilizing. So that way, once they get that patient in, if we're kind of past the point where we've been able to maintain and monitor, those other facilities already know kind of what we've done, and have an idea of where to start at from there.
Operating with this protocol, the cardiac protocol, or are you about to kick that off?
So we're in phase 2 of that. So we're probably about 90 days from initial kickoff for that.
Excellent. Great. So let me ask you another question that all the case managers and home health and hospice like to ask. Do you have any facilities that do have Medicaid pending beds, or are you currently accepting contracts for hospice agencies to provide hospice services to your residents?
No, absolutely. So in San Antonio, Las Colinas is definitely open for long-term care Medicaid pending beds. In the Austin area, Gracie Woods 1, Gracie Woods 2, and New Hope are all accepting. And then I have so then our Houston and Dallas market as well. Yes, they are. We're happy to do business with all the hospice companies. We're happy to do respites. We're happy to start the long-term care Medicaid pending process, even on hospice residents, which I know that can sometimes be a hard placement for a lot of these groups. But we just want to make sure that we work with our community and our fellow healthcare workers here, just to make sure that we've got places for these residents that really need additional care.
Services, I know that's a big question that most hospices ask from some of the local skilled nursing facilities.
Right. What are some of them? I'm sorry.
GIP services, if you have an RN that's available 24 hours at the facility.
Unfortunately, we don't.
No? Okay.
Unfortunately, we do most days, but it's not ever consistent enough
Okay.
to offer GIP services.
Okay. So if there's any hospice agencies out there that are needing respite services or skilled nursing facilities for placement of their patients, you can help with those services at this time.
Including same-day emergency respites.
Okay.
We can,
Excellent.
we are a 24-hour a day, 7-day-a-week business. I've admitted many residents at 10 p.m. at night on emergency respite basis. So we are literally open every second of every day to help with those things. And a lot of if you guys are having problems getting over the building, they're always welcome to call me. And I know my information will be displayed here at the end, but my phone is on 24 hours a day, 7 days a week, and I'm always happy to help place respite patients in emergencies, because it never seems to wait until between the hours of 8 and 5.
Or Saturday mornings or something.
Right.
As an administrator of a hospice in the past, I would run into that all the time. So I'm sure hospice agencies that are listening in right now would really appreciate the fact that you are so accessible to them, especially for those last minute placements that you may need. So that's great. So kind of going into our topic of today's meeting, we recently were informed by Texas Health and Human Services that they're going to allow brief visitations for families. Can you tell us a little bit more about the directives that you have been given and how this is going to impact your residents and the families at your 15 locations throughout Texas?
So, it's been since March when we went into lockdown. This has probably been the hardest thing that we've ever had to tell a family member, is that, unfortunately, you cannot not see your loved one, because of course we're utilizing telehealth, televisits and FaceTime, and they're doing a lot of window visits and stuff. But you can't physically lay eyes directly on your loved one across the table from you in the dining room, or sit in the room and hold their hand or things like that. That's probably been one of the most difficult things that we've had to tell families. We're really happy that HHSC has kind of brought this plan out, phase one of the visitation. So all of our facilities have already submitted the request, and we're all falling within the parameters. We don't have any active cases. We haven't had any active staff in the last 14 days. The state has cleared us on all our infection control policies and things like that. So we're getting into that phase where we're getting ready to start allowing those visitors. It seems like we're going to be doing 15 to 20-minute visits, and then another 10 to 15 minutes in between, to allow the ability for sanitation and things like that.
So I know that's going to really impact the families and the patients especially the patients who've been dealing so much with this social distancing from their family members and the social isolation, you've just seen a huge turn in their health care right now because of that. So how are you and your company planning on balancing the visitations and still making room to ensure that y'all are maintaining your excellent infection control standards that you have in place right now?
So the biggest thing is, and this is going to be the hardest thing for every family, especially since they haven't, laid eyes directly six inches apart from each other, is the biggest thing that HHSC mandated that they wanted to ensure is that there was not physical contact. The families have to call, they have to schedule a time. They get very specific times that they can come up to the building and visit. We've already identified outdoor locations in the facilities that are helping, not only have an area for them to come, but we're also making sure that it's providing additional safety for the resident, including shade and things like that. It's Texas, it's August, it's hot, and even in that 15-minute period, people that already are not super used to being outside and things like that, they can get sunburned, they can get a lot more dehydrated and things like that. So we've been working to identify specific locations in which we can set these up. HHSC has not gone as far as to say that we're going to have to use like a plexiglass barrier. I know that that's been a conversation, but it's not actually been a mandated thing that they've come out with. And that is one thing that we are discussing about putting up, just to help with that. We're going to have to, whenever the family calls, schedules the appointment, when they come up day, they're going to have to call and let us know. We'll go out, we'll do a physical screening, same questionnaire, temperature readings, things like that. And then the visits will have to be in an area where they can be monitored, just to make sure that they're not, human contact and things like that, which is going to be a very hard situation. I mean, you've not been able to hug your mom or your dad in the last 6 months, and I put myself in their shoes and I empathize, and I'd almost be one to try to break the rules a little bit, but we've got to make sure that we're protecting the residents the best way possible. While the residents are out, they're going to have to wear masks as well, and then they'll have to continue to be monitored for signs and symptoms of COVID on a regular basis, just by temperature readings and things like that throughout the day on their shifts. There's also got to be adequate hand sanitation protocols put in place. So we'll make sure that the residents are getting their hands washed before and after, that they've been outside, and then just, adequate monitoring after that.
You have a good process that you're already implementing, putting into place in preparation for this. So I'm sure your residents are definitely going to appreciate, as well as the families who have definitely missed coming to see their loved ones without a window in between them.
Right.
So is there any other questions or messages or information you'd like to share with our viewers on the services provided by Caring Healthcare Group?
Well, so I want to be very specific about who Caring Healthcare actually is.
Okay.
So, I hear names, and then, we're not the Regencies or Fundamentals or people like that in the world. So I want to tell everybody who exactly the buildings are and things like that. So in San Antonio, I have Las Colinas at Westover Hills. We've been in business there for about 3 years. In the Austin area, I have Gracie Woods Nursing Center and Gracie Woods Living Center. They've been in business there for probably about 22 years, and we've owned them for the last 8. And then I have New Hope Manor in Cedar Park, which was actually the only nursing home between Austin and Killeen for probably about 12 or 15 years. That building actually is a unicorn. I have an administrator that's been there for 17 years, and all of my department heads have been there for greater than a decade together, which in this business that is a feat. In the Houston market, I have Spring Branch Transitional. We actually purchased the old Spring Branch Hospital and renovated that, and that's actually where we have the Korean unit, and it's actually a very large geriatric psych facility. And then I recently just opened the doors to Highland Park Healthcare, and that is in the Heights in the Houston area. So we owned and operated a very small 50-bed building. And then about 18 months ago, we shut that facility down, moved all of our residents over to a brand new state-of-the-art 120-bed facility, and that's Highland Park. And then outside of Dallas, in the Waxahachie Ennis market, I have Bluebonnet Rehab and Ennis, which we purchased just about a year ago, and it probably has one of the most beautiful Medicare wings that that you'll actually find in a SNF that's been open for a while.
For case managers, for patients, for their families who are looking for facilities, whether it be for acute or post-acute or for long-term services. So thank you. Well, if anyone has a need for services or would like to contact Mr. Sam Hines regarding additional information, we will list his contact information here on the screen. Once again, my name is Erica Sandoval. I'm with Lonestar Visiting Physicians. And should you have any need for services for yourself or any of your patients, please don't hesitate to contact us. There's our number now. So please don't hesitate to contact us. We strive to provide the best in customer service, as well as timely intake and scheduling practices to get your patients services with a timely and immediate need that they have recently had, especially with the pandemic going on. Thank you again to Home Care to Go for allowing us this platform and the opportunity to bring awareness to our community regarding local healthcare businesses and leadership to our community that we can trust by experts in the community who actually know what's going on with the type of demographics that we're dealing with. You can see this recorded conversation on Home Care to Go's website or on our Facebook, YouTube, or Periscope pages. Follow us on social media and get notified whenever we may be going live. Thank you again, and all of you be safe and have a great day. Bye-bye.